Something happened to me in a healthcare setting that a lot of older people will recognize. What happened in that room wasn't just a misunderstanding. It was a complete breach of collaborative and ethical care. In just 10 minutes, I witnessed everything that's going wrong with healthcare. I have over 45 years of nursing experience. I understand how healthcare systems work. I've watched them change in those 45 years. I understand standards of care and how vital they are in healthcare today. And what happened to me in that room was none of those things. As a 70-year-old woman, I've taken care of my healthcare since I was in my 20s. I exercised, I biked, I hiked, I ran, I skied, and eventually snowboarded. I've been into my health my whole life with exercise, diet, supplements, and alternative and holistic practices. I went in for a visit for a follow-up after a shoulder injury, which had eventually repaired through physical therapy and chiropractics and acupuncture. And at the end of the visit, he asked me if there was anything I wanted to share with him. And I said, yeah, I want to let you know that I stopped taking my blood pressure medicine. I explained to him that I was having just awful diarrhea right after I would take it. And I actually did a little trial on it, stopped for a couple of days. The symptoms went away. I went back on, and again, I had the symptoms. And obviously, I looked it up because I do that. And that is a side effect. Anyway, the first thing he said was, oh, well, that explains why your blood pressure is so high. Well, I didn't think my blood pressure was that high, but I do get white coat syndrome. And the next thing he said is all this evidence of how high blood pressures in older people causes strokes. I understood all of that. As I tried to explain to him how I had stopped drinking, I bought a treadmill and I was exercising. He was interrupting me over and over again, talking over me. In the meantime, all of my symptoms of the diarrhea was gone. I was having normal stools, which isn't that everybody's dream. And when I explained to him that I was trying to see how my body would respond to it, he became very firm. Every time I tried to speak, he interrupted me. And when I tried to share something important to him, he said something that stopped the conversation for me immediately. He said, I don't really care what you think. The message I received was clear. There was no longer room for conversation about my health. My perspective of my health was no longer wanted in this conversation. I thought, if this happens to me, someone who's super smart and educated in healthcare systems, what happens with everybody else? How many other people have been silenced for advocating for themselves? So I put together a handbook for all of you to look at before you go into your doctor's office so that you understand what the expectations are for that relationship between physician and patient. It's called What Collaboration Means in the Healthcare Setting, Reflections of Collaborative and Ethical Care. You deserve to understand what respectful healthcare looks like, and you deserve to feel empowered when you walk into that appointment. You're not difficult because you ask questions. You're responsible and you are informed. That should be celebrated, not silenced. I've shared the link below for the handbook because you're not trying to be difficult. You're actually trying to stay informed, and that should be celebrated, not silenced. If this video spoke to you, please like, comment, and share below.